Afternoon, everyone, and thank you for joining us. My name is Tariq. I'm a Whaler One man from Canamble and an engagement assistant for Cracks in the Ice online toolkit based at the Matilda Centre for Research in Mental Health and Substance Use, located at the University of Sydney. It is my great pleasure to welcome you to today's Cracks in the Ice webinar. Before we begin our webinar, I would like to acknowledge the traditional owners of Australia and recognise our continuing connection to the land, water, and culture. I'm currently on the land of the Bendigo people and pay my respects to their elders past and present. I further acknowledge the traditional owners of the country on which you are on and pay respects to their elders past and present. I would also like to acknowledge any Aboriginal and Torres Strait Islander people who are amongst us today. Today's presentation is one in a series of webinars which is running as part of the Cracks in the Ice online project. If you haven't already seen the website, I would encourage you to visit www.cracksintheice.org.au, and we welcome any comments or questions you have, so feel free to get in touch with us at any time. Before I introduce you to today's speaker, I wanted to let you know that as participants, you are in listen-only mode. This means that we cannot see or hear you. However, you will notice that you have a Q&A button on your dashboard. This is where you can type in questions that you have throughout the webinar and send them through to us. We will then have a question and answer section at the end of the webinar. I would also like to let you know that we will be recording the session today, and we will be making the recording as well as the slides available to you through the Cracks in the Ice website. So without further ado, our speaker today is Dr. Connie Henson. She is a psychologist and public health researcher with keen interest and ability to translate science into language and tools that are easily accessible for non-scientists. Her work spans conducting research informing grassroots community projects to consulting to multinational corporate organizations. In collaboration with Aboriginal and Torres Strait Islander colleagues, Connie is researching how older Aboriginal and Torres Strait Islander women use technology to improve health in their communities. One of her many previous research projects included collaboration with Fijian colleagues to design a culturally informed approach to hospital and community counselling and a suicide risk assessment tool. She currently works as a research fellow and is on the board of directors for the Newtown Neighbourhood Centre. She also has affiliations with Durrali Centre for Aboriginal and Torres Strait Islander Health Research Education and the Department of Health Science Faculty of Medicine, Health, and Human Sciences at Macquarie University. Thank you for joining us. We're extremely lucky to have you with us today, and I'm sure this is going to be an interesting session. I will now hand over to you to make the presentation.
Thank you, Tariq. I really appreciate that. I'm going to just quickly share my slides so that I can talk with you about these. So thank you for that beautiful acknowledgement of country. I would also like to add my acknowledgement and to pay my respects to elders past and present on this beautiful land that has never been ceded. I'd also like to extend that respect to all Aboriginal and Torres Strait Islander people who are here today. As a non-Indigenous researcher, I am absolutely privileged to be able to work alongside my Aboriginal and Torres Strait Islander colleagues, both academic and citizen scientists, to conduct this research. And I absolutely want to acknowledge the incredible contribution that others have made. And in fact, I have listed a number of authors. I'm going to be talking about 3 studies today. And our research projects at the Durrali Center tend to be projects that involve a lot of people, both academic and citizen scientists. And so I've listed a number of people here today. And in fact, I think a couple of the people who are authors here today might be with us. I hope that's right anyway. So let me launch in. I'm going to talk about 3 different studies today, and they all link together. So the first study that we did is we were looking at what kinds of internet use do older Aboriginal adults, how do they use the internet around health? Because we knew there was high internet use, but we didn't know, well, is that just people in the city, or is it, all people? There's always a lot of talk saying, well, older people don't really use the internet. It's like, well, let's actually have a look at that. And so we went to 3 different locations. As you can see, I've listed there, the majority of the people in this group, there were 78 adults, 44% were from a remote location. We also had regional and rural. And as you'll see there, older women were the largest group, almost a little bit over 50% of our sample were older women. And what we defined as older women was basically seniors, baby boomers, and X-Gen. And that's an important distinction because anyone under this, that X-Gen generation, they kind of grew up with the internet. And those of us with a bit more gray hair, we didn't grow up with hands on keyboards. We grew up in a very, very different way. Telephones were big technology for us. And so we've learned that as adults. And so the research in the area of like around digital communication and digital, just use of digitals in general, is that older people don't use it as more, maybe are not as comfortable. And my experience for myself and for other people that I was around is like, geez, I think a lot of us do. And so I wanted to look at that. And so this is the sample of people we looked at, and we were basically surveying people. And what we found is that most of these people indeed do use social media. In fact, 72% of all of our participants use social media. And I've listed, as you can see, each of the different kind of cohorts, if you will, older women, older men, younger women, younger men. And the older women are really heavy users. 77% of the older women are using social media, particularly around, they use it for health reasons. The younger women are the biggest users, 92%, and the older men, the lowest users. But look what happens when we start looking at, well, what kinds of platforms or how do you get health information? And the top choice is Facebook. That's followed by Aboriginal Health Services and then YouTube. In some ways, and I'll just kind of give a little commentary as I go along. I wasn't super surprised by the Facebook, again, because of colleagues I had that I knew used Facebook. I wasn't super surprised by the Aboriginal Health Service because I think that is such a trusted organization for many Indigenous people. And so I thought they probably would use that. What I was surprised by was the YouTube. That was really interesting because I guess I just didn't expect it. Maybe I had that same prejudice thinking younger people may be focused more in that area, but that's what we saw. And then when we ask, well, which ones do you trust? Because it's, all of us will use the internet for various things, but we may or may not trust the information we get. And so we ask, what do you trust? And the most trusted sites were Aboriginal Medical Services. And Facebook was the next, government websites, and then YouTube. I must say I was pretty pleased to see that the AMS's websites were highly trusted places, because if you think about that has a lot of implications for what we might do around health promotion, because we've already got a trusted entity, an organization that people feel comfortable and safe with. And so using this new medium, that it's not that new, but it's using this as a medium to get information out for people is another really good possibility. And so we're thinking about, because the thing about social media, it's not just a static thing. People don't just get information, they then share it. So we started looking at, well, all right, how many of you get health information online, and then who do you share it with? And so we first looked at, how do people share that information online? And just to explain what I've got here, so this is we're looking at sharing, once you get the health information, what do you do with it? And we said, do you share it online? And if you do, who do you share it with? And so this orange is saying, well, I share information with people in my household. I do it online. I might tag them in a Facebook page, or I might email something to them, but I use an online medium. This darker space right through the middle is saying, well, I do this with my family. And family was defined, could be a very extended family. And then out here, we've got friends. And so I think I'll just call your attention to, as we saw before, the younger women are the ones that are sharing the most online. They're the biggest users, and they're the biggest ones sharing health information online. But look what happens when we ask, do you ever share that information in real life? So I get the information online, but then I tell someone about it. I talk to them about it. And look what happens. We've got a lot of older women sharing their health information with others. And if you think about older women being, older Indigenous women being trusted members of their community, people who someone might go to ask about their health, to think about their health. And we've got these women getting this information and then sharing this information. It really got me thinking about, and I think some of my other colleagues about, this is a really a great potential resource for getting information out, sometimes to really hard to reach people who might not be super connected in. Okay, I'm going to move ahead. I'm going to kind of move through these so we'll have plenty of time for questions, but anything that you're thinking about, please pop it in the chat or into the question and answers, and I'll be more than happy to talk about it as we go along. So the next thing we looked at, so we've been looking at the internet and how people use that to get health information. The next important thing that I wanted to ask about was, how about using wearables? And so the first question we ask is, have you ever used a fitness tracker? And we did this study about 18 months ago. So things, even in this 18 months of time, have changed. At that time, note that it's younger women are the only ones that are really using fitness trackers of any type at that point. All the others under like 20%, our older women were about 18, 19%, I think. Older men, not at all. But what happens when we say, would you like to use a tracker? And look what happened. 83% of the people wanted to use a health tracker, 92% of older women. So this is that group of people that people think, oh, older women, they wouldn't want to do this. It's like, well, guess what? They do. They're really interested in technology. And when I look at these two charts, what that says to me is the lack of use is probably because of access, not because of interest. And so that specific finding really made me super interested in doing some kind of wearable study. So what could we do to test out, well, if people do have access, how does that go? So the next study we did was we did a study where we looked at the acceptability of wearables. And there were certainly some questions about this, because if you think about a wearable, whether it's a watch or a patch or rings they have now or other kinds of wearables, you're essentially putting yourself in for 24-hour-a-day surveillance, because these information that come from these things go into the apps and then, go into the cloud somewhere. And I really thought about it. A number of us thought about, it's like, oh, just what about, the feelings of safety, that, is there comfort around that kind of surveillance? Will people feel comfortable? Will they feel safe? And so the first thing we wanted to do before we ever even tried to find out how many steps people are taking or anything like that is, are they comfortable using these devices? And are they acceptable, if you will? So we partnered with an AMS. Actually, they're very happy for me to say the community is the Brewarna, which was a most wonderful community to do this project in. So Katrina Ward, who runs that AMS, was a major partner in this. And we recruited through the AMS 11 older Indigenous people. The youngest was 58, and the oldest was, I'm thinking, was 88. I can't remember that number right off the top of my head, but a good range of people. So we were not talking youngsters here. We're talking people who are certainly, well into their middle and older age. And we did a 5-day study. We used these watches that are right here. These are called withing watches, and you can see they can measure atrial fibrillation. That's just like the little ECG that you see, on television, or if you work in hospitals or in clinics, you will have seen them with the 12 leads. And that's what most people think about, is the big stick-on things you have to put on your whole body, 12 of them. But now these watches can measure them just through the watch. And that's what the app looks like. We also had, in addition to the watches, I didn't take a picture of it, but a patch that's about that size that was on people's chest that also measured their blood pressure and their atrial fibrillation and some other things as well. So we have 11 people in the study. And I've told you the ages already. It's both men and women, mostly women. And we were going to go for 5 days to do this. Now, you would know that the week we decided to do this, it was in February, so we were sort of playing with fire there. it was hot. I don't think there was a day below 38. And so we've got people who are older, they're wearing these things. Many people didn't normally wear watches at all. They certainly didn't wear badges on them. And I thought, geez, I wonder if we're going to be people who to tolerate this. I cannot tell you what a wonderful group of people I worked with. And of course, there were also, we're working like in a situation where most people don't have internet in their home. They, there's the cost factor, even though of course we were supplying the devices. It's like even just being able to access internet has a cost associated with it and a connectivity issue. And so we had to work out those kinds of things. And what I think I absolutely loved about the study is I felt like those participants were incredible citizen scientists. We worked literally shoulder to shoulder in trying to work out how do we make this work here in this place with this group of people. And what do we need to make any modifications? How do we need to set this up? Because that's what we wanted to find out. And we wanted to find out, are they safe? Are they comfortable? Are they convenient? And we did. After the end of the week, everybody rated their devices as feeling they felt safe. They felt safe about how the data was stored. They didn't feel uncomfortable. I was actually very surprised they were not uncomfortable about the data being stored at all or the 24-hour-a-day surveillance. They felt comfortable. That was also something I was a little bit surprised because it was hot. People said there were times there's a little bit of itchiness with the patches, but everybody kept them on the whole time. And they felt like it was a really convenient way to get information. Now, that was the goal of the study, to try to find out that. But what else we found out is, one, the thing I already told you about, just the incredible interest that the citizen scientists showed in this. But I had people who were asking me, well, okay, I can see this thing measures steps. I want to set some goals for myself. I want to have a program that I can actually use this to improve my health. And it was, and some of you may have experienced this if you work in some of these places. I was quite inspired by people who, and all of these people had at least one chronic illness. That was an inclusion criteria, but yet their interest was so high in using devices to improve their health. And so that has led us to a study I'm going to just tell you a little bit about. It's not part of what I'm talking about today, but we're now looking at putting together programs that include the wearables, but also include like online educational and motivational type programs, so that we can use the devices not just to measure something like atrial fibrillation, but to measure steps and other kinds of exercise, which we know are important for any wide variety of health conditions and chronic illnesses. Now, as I said, we use these devices to measure atrial fibrillation. And just for those of you who may not have ever heard that word before, atrial fibrillation is basically an arrhythmia of the heart. And it's an important one because it can lead to stroke if it's undetected. And the sad part is it's really easy for it to be undetected because it often doesn't have symptoms and it's often intermittent. So even if we measured it all the time, we may not pick it up. It's like it's not there all the time, but nevertheless, it can still be putting people at risk for stroke. And so the wearables are an incredible leap forward, because if we can measure people all the time, then we can pick up a lot of atrial fibrillation that we might not have known about. And so from previous research that my colleagues have done over the course of the number of years, we know that atrial fibrillation is much more prevalent for Indigenous people. It's about 7%. And so being able to find that 7% and then treat them, because they're good treatments, we can prevent many, many, many strokes. And that means, and I always get excited when I think about this, it's like there'll be people walking around on this earth that wouldn't have been here if we didn't do this kind of work. So that was the very first study we did. And I've told you we've got some other ones underway. I am just so excited about where wearables can take us, and the fact that what we're finding in our research is that and in some ways not surprising at all, Indigenous people in Australia are really keen for technology, are really keen to use it as part, and older people, not just younger people, but older people are really keen to use this to improve their health, both for screening, detection, and for fitness health type things. Okay, I'm going to leave that one and I'm going to go to another study. If you remember back, I'm just going to go back a couple of slides here. Remember I talked about this getting health information and sharing health information. So that's the sharing. And remember we had older women are really interested in getting health information. Actually, it's one slide back, I think, 2 slides back. So we see that there's a lot of interest in getting that health information. So in addition to the wearables, the thing that we also wanted to look at is, well, okay, well, what are older women getting the information they want? What do they want? What are they seeing when they look at the internet, when they look at social media? What's important to them? And this is what I say this about every study, but I have many favorite studies. This is another favorite one I did. And actually, I hope one of my colleagues, Felicity Chapman, is here today, who helped me a lot with this study in recruiting and interviewing and doing yarning circles with 24 older Indigenous women. And again, we defined that we were looking for seniors, baby boomers, and X generation. So everybody was 42 years old or older, did not grow up with the internet. We managed to recruit 24 people. And we did this in kind of an unusual way. Rather than going out to a community like we did with Brewarna or to the other communities as we did with the other study, this was a 100% online study. We did this during COVID. And another colleague of mine, who is here today, Carol Vale, must give her credit for this. She gave me the good idea when I was the beginning of COVID and I wanted to do this work. And she said, Connie, don't think about a community as a space, as a place, think about it as a space. And she suggested that we recruit women through online communities. And so that's exactly what we did. So in the end, we had 5 different online communities of older women who use the internet in one way or another to connect with other women. And so we found these 5 different communities that were willing to connect with us and were willing to invite their members to come and yarn with us. And we ended up, as I said, talking with 24 women. Sometimes we talked to them just one time. Many of them we talked to 2 or more times, and it was all online. We did use yarning as a method, and by that I know a lot of people define that in different ways, and it has lots of social and cultural meaning probably for many people on this call. We have adopted this method so that basically we're trying to do is make it really safe for people. Because if you think back, 18 months ago, even a year during COVID, still online could be a little bit uncomfortable for people. We weren't as used to it as we are now, where we're, online so much of the time. So we wanted to make it really comfortable. We wanted to not overstructure it like a lot of focus groups are in research. We wanted it to be a fluid conversation. And that was particularly important because the questions we were asking, we didn't have questions that we could answer yes or no, or that would have, we knew exactly what we were looking for. We were trying to explore. And so Felicity and a couple of other colleagues and myself, we talked with these women either individually or in groups. And we asked about how they used the internet, particularly around health information. And we asked what was important to them. And one of the things that came out, one of the most important things that came out, is they talked about the lack of equity that they felt. They don't see themselves reflected in what's out there. And they want to be. We'd done another study where we looked at the research, published research around older Indigenous women across the world, and only found 3 studies where older Indigenous women had been included. And so we're the 4th study where that happened. Hopefully some others have happened by now. But what they said to us is we don't always feel included. We feel like There's not programs that are specifically for us, to online programs. There's not information that's specifically for us. And sometimes even if it is, it doesn't come to us in a way that feels comfortable. So we continued to ask about those questions, but we pivoted a little bit and said, well, if we're not having equity in digital health, because that seems really important, what would it take to get equity? And we thought these women would be ideal to help us understand that. And so we talked to them about how could we build a model for digital health equity? What would that look like so that we could use that to inform people who are putting health information on the internet, be they, programs, it could be an AMS, could be a government website, could be private, but what needs to be there so that older Indigenous women feel included and feel valued in that space. And so this is the model we put together. And so we said the very first thing is what I'll call conditions for use. If people don't have financial access or technical connectivity, we are not getting anywhere near equity. And the women pulled this out. Now, these women, keep in mind, these were women who all probably did have good technical connectivity because they were able to do Zoom calls with us. Many of these women were very well educated and worked professionally. But the first thing they talked about was, I want to talk about my community of other older Indigenous women. And I have family, I have friends, I have colleagues who don't have this kind of connectivity, be it for financial reasons or because they live in places that don't have good connectivity. So I think that's one of the first things I take out of the study is it's absolutely bottom line, the foundational thing that has to be there. And I think as a nation, it's something that we have to think about. How are we, if digital health is here to stay, it's just going to get stronger and stronger. It's not becoming I don't know, like a luxury. It's now becoming a necessity and therefore a right for people to have that. And so this is the number one thing that needs to be there. Then we looked at, so if we get that, that's a good step. Then we got to move to, well, what are the elements for efficacy? So I got it. Now, how do I make it work for me? And these four that I've put in this darker color here were the things that came out as important. So one is safety. Do I feel like I've not myself, but for these women, do they feel like it's free of racism? And many did not. Many experienced racism when they were on social media or other parts of the internet, or even just a poor sensitivity about their needs. So that's number one, is we need to have safety. There's a lot of talk generally about that and some of the perils of the internet space. This next one is also important. This is accessibility. And so different from the connectivity over here, this is language and the comfort in the way information comes. So what the women talked to us about is, again, it was quite a specific group of, pretty well educated professional women who could read anything that was thrown at them. But again, they were thinking about their colleagues. They were thinking about their family members. And they said, people don't want to read a lot of dense material, particularly what you find on government websites. You try to find out about something, it's dense, it's complicated, there's words that they don't normally use every day, technical language, and that is just a turn off to people. It feels like it's saying, don't come in to this site. What they wanted, and now think back to that first study I told you. Remember I said we found out that YouTube was super popular? This comes up again. So people are talking about the video as a really great means to get information. They like being able to hear someone talk about it, share show pictures, that sort of thing. People also like a lot of pictures, diagrams, and low amounts of words. And if there are words, that they be like normal everyday language, not technical jargon, because that just doesn't feel accessible. It's a turnoff to these women. And they would say for other people as well. And I wouldn't be surprised to know that. So that's a pretty important thing. I'll divert just a little bit to tell a little story about accessibility. In another piece of research that we're working on, again, around the atrial fibrillation. We're trying to get people to come into AMSs to get tested for atrial fibrillation. And we tried lots of different things, some posters and that sort of thing. And we just came upon doing videos with some of the Aboriginal health workers talking through some of the things that are fairly technical, but in a way that is very accessible for people. And we've made a couple of videos now, and we're getting it's just starting, but a good response to it. And I think this is where we're trying to already put the model into place to say, well, what do we need to do with this to get information across to people? And I think video is a really important piece. And again, accessibility in general. This next one that I've got here, I've called relevant content and functionality. This was a particular issue for older women. If you are an older Indigenous woman yourself, you may have experienced this, or if you have relatives or friends or colleagues, you might be aware. I can even say this is somewhat true for non-Indigenous older women. The content just isn't there. Things are geared for younger people, younger audiences. There's a lot of information about pregnancy and childbirth and that sort of thing. That tends to be the focus when women come into the picture, but not so much about the kinds of needs and questions and concerns that older women and older Indigenous women specifically would have. So they feel like they're missing, they're seeing themselves as sort of missing in action on the internet. And so they want that relevant content. Same thing around the functionality of being able to have many, it's getting better, but a lot of times historically, medical devices, that sort of thing, are made for a different size body, and women a different shaped body, and women feel left out of that space, and so they're looking for that functionality that's particularly relevant for them. The fourth one, practicality. I cannot tell you how much this was emphasized. The women that I worked with, and my colleagues as well, Indigenous women that I know and work with every day, practicality is important. People are very, very busy. They don't have time to mess around with things that are not practical or theoretical. It might work, or they might not, or there's a whole lot of mumbo jumbo about making it work. They want a practical, useful, efficacious things that they can take and pick up and use right away. Now, what they said is if we have this financial access, we have technical connectivity, and we have these four things: safety, accessibility, relevant content, practicality. Well, that's minimal efficacy. We can get value if we have those things. So sometimes we do, sometimes we don't. When we do, it's basically useful. But what they said to me, or to us, is there's another element that's really important that's missing. And this is really missing in action. This is the cultural sensitivity. So what the women talked about was that they felt like they had quite unique needs as Indigenous women. And they even talked about could be quite specific to their language group or to their nation. Because of cultural sensitivities, cultural needs, cultural requirements, that they felt like the internet, the way that it works now, the way that social media works, it's not meeting those needs. And they gave quite a few examples. I'll share one that they were happy for me to share, which is some of the health questions that they have. They felt like was quite inappropriate to be discussed if people who were not older Indigenous women were privy to that information. It needed to be discussed among people of like-minded, like people, and they felt like that privacy was really important. So like almost like closed groups, but yet permeable, so that the information that was useful could come in, but other people that shouldn't be there wouldn't be there. So that was an example that I thought it really made sense to me. Again, not being my culture, but that made sense that it was easy to understand that was an important thing for them. And they talked about other kinds of things that were important to be able to access both Western and Aboriginal medicine and health information. And they talked about it quite broadly. So health was not just about test your atrial fibrillation or just take a pill or have a diagnosis, but it was much broader, which I think is my understanding. And again, others would have a much better understanding of this, but that broader sense of health and well-being needed to come into the picture. And so people talked about health information should include nutrition, should include exercise, should include community, spirituality, these kinds of things that you don't typically find on a Western health site, but they felt like that was important. And they also felt like it was important that it include people with health backgrounds, so physicians, nurses, Aboriginal health workers, and that it include people who maybe, in the Western approach, we might not think, oh, they would be included in this, but elders and people who were healers in their community need to be part of that as well. And they felt like if they could have all of these things, so, we have the basics, then we have the elements for efficacy, and then the cultural sensitivity, then they feel like they could derive full value from the site and from the platform or whatever it was that we were looking at. So that's the Durali model for digital health equity. We're going to be continuing to build this out. And the next step for this research is to start looking at, well, what does it take to build some, whether it be platforms or groups or what have you, to build this in for older Indigenous women. What's the next steps in actually making that a reality? Just like we did with the wearables, this one we want to take to that next step. And so again, the way we will do that research, and I'm just going to take a minute here before we start wrapping up to talk about in general how we do research. And I'll just actually stop sharing screen. And we're going to go to discussion in just a minute. Our research is all co-designed, and it's all co-designed with community members. So there's always citizen scientists who are a big part of the research. And that is particularly important, I think, as a non-Indigenous researcher, because the voices that need to be privileged are the voices that this research is for and about. And that's Indigenous people, and in this case, older Indigenous women. So as we design these next steps, it won't be someone like myself sitting in the ivory tower thinking, well, what's next? As you can see, the way it builds is because of what the participants tell us is important to them and what they tell us should be there. So then the wearables, we chose that because everybody wanted to use wearables. They wanted to give it a go. We looked at what older women wanted because a lot of them were using the internet. Now, the next step is in the wearables, the people that we worked with said, we want to do some things around fitness. We want to use these things to track aspects of our health. So that's the next step there. And what the women were telling us is equity is important. We want to see ourselves reflected. We want to feel that we have had a fair shake at this as well. And so now the next step is we build that out. So that's just a little bit about the way that we work. And I'm going to stop now because I've been talking for quite a bit of time, and I'm really keen to hear your questions. And I'm also really keen to hear any comments that others. There's going to be plenty of researchers in this group and plenty of practitioners. So please share your wisdom as well.
Thank you so much for the presentation, Connie. Yeah, it was really eye-opening. I was not expecting, older Indigenous women to be using technology more than their younger counterparts. Yeah, it was really eye-opening.
It's cool, isn't it?
Yeah, definitely. Yeah, but we now have a few minutes for questions. But yeah, so feel free to drop some down below. I wanted to start you off with one.
Okay.
Yeah, do you think during the COVID time period, has that helped with access or willingness to use digital technologies in older Indigenous women?
Look, I think so. I think there was probably already a good bit of use there. Some colleagues, Bronwyn Carlson being a key person who has done research. She works in the area of like contemporary Indigenous issues and had done a lot of work around social media and social media use, particularly around political empowerment and social connectivity and global connectivity with Indigenous people, and was finding that people were using it. Now, she didn't look specifically at older people. It was more kind of general range. But so the use was there. And in fact, just a couple of little tidbits. early on in the piece when like when smartphones just first came out, somebody, I'm not going to recall the name now, but they did a piece of research in a more rural community with a high percentage of Indigenous people in Australia, and the mobile phone use was very high. Even though people didn't even have connectivity in their homes, they were hotspotting and that sort of thing really early in the piece. And this is also very exciting for any of you who work for AMSs or other ACHOs. Aboriginal Health Services were among the very first in the world to start putting health information online. So that connection is there. I think COVID sped it up.
Yeah.
So long answer to your question, but that's what I think happened.
Yeah, thank you. We just have a question from Greg. Do you have any further insights or comments on the difference between older men sharing online versus in person?
I don't. I did collect that little bit of data. My research has been mainly around older women. Older men are just, and this is interesting too, because in the early days of the internet, men were much more heavy users of the internet than women. And then that seems to have shifted when the social side came in. So social media, that connectivity piece. If that's the reason why, I don't know. But what it looks like now is there's, particularly among older people, it's the older women who are much more used. The younger men more than they're still not equivalent to younger women, or they're not even as high as older women. But the older men, it's not as, they're just not interested, at least in our research.
I also want to ask, how did the model of digital health equity sort of come about?
Yeah. Well, so what happened, we had these yarning, either individual yarns or yarning circles. And early in the piece, it kept coming up, the issues around equity. And we'd done, as I mentioned, we'd done a previous piece of research where it was a systematic review where we just looked at older Indigenous people across all high income countries using technology. And we found out there that there's not a lot of research about it. And so that kind of piqued my interest right there. It's like, why hasn't this been researched? And then when I started talking to women and they're saying, well, my needs aren't really met here. And that felt pretty important, and because that was coming up early. So we pivoted a little bit. We still ask the same kinds of questions around use and what do you want and that sort of thing, but we started asking about, well, what would make this more equitable? What would make this work for you? And so as we asked that, those of you who are researchers, you would know you get piles and piles of transcripts and you start going through it. My colleague Felicity Chapman, who I hope is on this call, and some other colleagues, we went through and looked at the themes. What's important? What are they telling us? And so we built out the themes that we heard, and then we put them together. So, oh, these kind of fit together this way. Then we took that model back to participants. So we did some more yarning, and we showed, here's what we've come up with. Here's what we heard you saying. And we had quotes. I didn't put them in here, but we had quotes from women about each one of those things. And we said, does this resonate? Does it really fit? And what we found in there is they did say it did resonate, and they emphasized even more strongly than we had in the first place around that cultural sensitivity piece. And they elaborated a bit more about what they wanted and what that should look like, which is what's led us to the next piece.
With the yarning circles, were they in person or Zoom? And do you think doing the Zoom calls impacted engagement at all?
Look, it's a great question. I get asked that all the time. We had very engaged people. It was not like I had to go, oh, come on, what do you think? There was no problem there at all. It was really lots of good talking, lots of good sharing. So I never felt like we were missing that. And I do think this is back to your previous question about what would have been like before COVID. I don't know. I did some of my work had been online before. I know people were not as comfortable as we all are now. But so it's one of those $1 million questions, because I didn't have a control group to see what it was like in alive. But I definitely don't think it impacted in a way that people were unwilling to talk, if that's the question.
Yeah. And are these studies New South Wales based or national?
The one with the 24 women, the last one I talked about, that was national, because we recruited online, and I was in New South Wales the whole time, but they were all over the place. And so they just had to be in Australia. So we asked for Aboriginal or Torres Strait Islander or Torres Strait Islander women. That was really the only criteria. They'd be older and Aboriginal or Torres Strait Islander. The other two studies, one was Brewarrina, so that was New South Wales, and the other one was 3 locations, and they were all in New South Wales.
And you mentioned earlier that you were going to extend your research on the wearables, about people obviously wanting to track their health. What sort of measurements are you going to get from that research?
Yeah, so we've got a couple of things that we're looking into. So trying to get some grants, basically. Once we get some money, that's what it comes down to. But the things that we want to do, and what the community has been telling us that they want, is they like the watches a lot. They want to use those to they're happy about the atrial fibrillation. They think that's cool, but they want to be able to measure their steps. They want to have a community engagement. And they've talked, believe it or not, they brought up the online thing, saying, could we do this online? And, we come together online and then talk about how we're using it, setting some goals for ourselves. They didn't use the word setting goals, but essentially that idea. So we'll definitely go in that direction. The other thing that's come up with wearables is the other group that we work with. So those are participants, like community members, AMSs, and the people who work in AMSs, the doctors and nurses, the Aboriginal health workers, administrators. They are also really important partners for us. And one of the things that they've talked about is wanting to measure things like atrial fibrillation on a continuous basis in a way that doesn't have this whole Holter monitor and all of that business. So there's some patches that do that. So we'll definitely go in that direction. And we know that blood pressure, 24-hour blood pressure, is important. So we'll go in that direction as well. And then I just literally this week was talking to some colleagues on one of the AMSs, and they're really keen to do something around diabetes. And there's some kind of neat wearables there. So I can't talk a lot about it because I don't have my head around it yet, but I will, because that's what they're interested in. And we got a lot of diabetes in community. And so that would be a great place to be able to, if people can get their sugar under control, that would be pretty neat.
Awesome. And other than exploring wearables, what else would you like to explore in your research?
Look, I really like working with older women. And I just love the idea of how older women help each other and they help their community. And I see them as an incredible resource for themselves in their own right to get information and help for themselves, but also as people who the first thing they think about is someone else. They think about their family, they think about their friends, they think about their community members and their community at large. And so I'm really keen to explore with them on how we might work together and how we might use technology to strengthen that, if that makes sense. I'm always about how do you strengthen whatever's strong. And so how can we make use of kind of who they are, the relationships they have, the respect and credibility they have in their communities? Can we do that and pair that with their interest around the technology to do something? And I'm really keen just in general around working with older women in general, around fitness and health. I'm an older woman myself, and I love fitness and health. And so I reckon there's a lot out there like me that would like that. And so I want to do some more work in that space.
Awesome. Thank you so much, Connie. Yeah, thank you for presenting for us today. Unfortunately, that's all we have time for. Apologies to anyone who didn't get their question answered today. You're more than welcome to get in touch with us via email, and we'll respond to any questions or inquiries you have as soon as we can. We'll be holding more webinars and putting new resources on Cracks in the Ice throughout the year, so I encourage you to subscribe to our mailing list at cracksintheice.org.au to receive further updates. Thank you again for joining us, and I hope you all have a wonderful day.
Bye-bye.